And then please join me in welcoming Zach and James from Kitt Medical.
Owen Carey, Karen Beer-Chima, Natasha Ednan Laperouse. 3 young, brilliant people. 3 tragic, avoidable deaths, which all shocked Londoners in recent years. As a young person with a severe nut allergy myself, I'm genuinely terrified of being another name on that list. And I'm not alone. There are 550 million people across the world that suffer from allergies, and 1 in 5 live in fear of death. Adrenaline autoinjectors are the life-saving medication used to treat anaphylaxis, a severe allergic reaction. However, these medications are inconvenient, bulky, expensive, and easy to forget. That's why nearly half of all allergy sufferers leave them at home when they go out. I thought to myself at university, why can't we create a product just like a defibrillator for allergies that could go in all public spaces, from schools to restaurants, stadiums, and even planes? Well, now we can. My name is Zach, this is James, and we're the co-founders of Kitt Medical.
In our secure wall-mounted kit, we provide adrenaline pens, along with our management, reporting, and training software, all for the affordable price of £500 per kit per year. We have a passionate and experienced team, along with support from leading London allergy experts, patient groups, and a global pharmaceutical company. We've proved traction with a successful pilot phase in 7 schools across England and are now preparing to launch to the wider UK market, consisting of the 3,000 schools in London and further 30,000 across the rest of the UK. Because our country has one of the highest incidences of allergy in the world, costing the NHS £1 billion every year. Together, with the Mayor's support, we can save lives, implement change, and spearhead a new standard of allergy care, both in London and across the UK. Thank you.
Did you say annual? Is it an annual charge then for the kit?
Yeah.
Is that because it requires servicing or?
So the checkups will be completed by the nurses or the designated safeguarding lead in the school, but we're providing the kit with automated replenishment, so the medication inside is always in date and always stocked up.
What is inside?
It's a very good question.
So the kit will be wall-mounted itself, and we'll give staff these keys which they can wear on their lanyards, or they can go and break glass in case of emergency boxes near the kit itself. All you need to do is turn the key to unlock, and from there you take it with you to the emergency. Once you lift the latch, inside there are 4 auto-injector pens, which are just pre-filled syringes with adrenaline inside. They have 2 doses here, so one for sort of younger children, one for older children of different size. We've also got really clearly written out instructions as a backup, and then as soon as you use your medication, you let us know through our instant reporting software, and then we replenish that as part of the subscription.
Can I ask, how did your product change as you worked with users?
So our pilot phase was one of the most influential things we did with this product. Originally, I came up with it back in university in 2020, and it was very much a concept. From there, we developed a prototype, put it in 7 schools across the UK, and that was really an MVP that sort of went on the wall, and we didn't really have any backup software. From there, they allowed us to test out the cost of the product, what it looked like. We even changed the name itself to make it more easy to remember for the school itself. We tested out things like QR codes on the box, whether there are inhalers and Piriton inside the kit, the entire thing. And we worked really closely with nurses, head teachers, facilities and estates managers, and bursars to entirely shape the product so that it's in the mind for the school market.
It looks great, you know. I can tell you, good designer. It looks like a product that should be out there now.
Thank you.
My question is, can anyone use it, or do you need to have like first aid training or be a nurse? Could I just grab it and stick it in you?
Ideally, yes. That is really what we're advocating for. Just like when you see a defibrillator, you're immediately reminded that, you know, this is accessible, this is emergency medication, we should all be able to use this. The current case is that auto-injectors are hidden away in the allergy sufferer's pocket, and there's this massive stigma around using it. And by creating this really visible and, quite frankly, pretty-looking product that we can put on the wall, people can see that and say, oh yeah, I can use that in case of an emergency. And the actual misconception of adrenaline being harmful is incorrect. So it's always better, and with advice from leading allergy doctors and charities and pharmaceutical companies, they all say, if in doubt, use the adrenaline.
Really lovely product and really brilliant presentation. Thank you. I just wanted to understand the response time or critical response time for somebody reacting to getting the treatment. If, for instance, it's in a school where the teacher trained or who has the key might not be available immediately, how would that work, and what is the response time for that?
Sure. So essentially what we're doing is improving on the current situation. And you're very correct. It's really important to get that medication as quick as possible. Right now, if a school even does have the auto-injectors, because often they don't, then they're hidden away in a locked cupboard, often in the nurse's office. Most staff don't know where it is, things like that. So number one, even though this is locked, it's going to be visible and accessible. And when we did our pilot phase, we found, putting this in the school cafeteria or in the nurse's office, so it's completely, outside the nurse's office, so it's visible, is really important. But anaphylaxis is a time-sensitive condition. However, there's no specific information on how long it could be, because it really depends on how much the allergen has been ingested, how strong the allergy is, whether they've done exercise, whether they had food prior. There's a whole bunch of things in mind. So really, we're just about putting as many of these in accessible locations in schools as possible, so people always know where it is.
Perhaps maybe having some of the prefects trained in the school, perhaps, like the fire marshal.
So a lot of it is about providing the fundamental training, but it's also about advocating for these to be placed in specific locations. So, as Zach said, cafeterias are one location. Schools where they put defibrillators is another obvious kind of testing point for where we should be putting them. But the training is really fundamental, the location, and the access to the key is something we learned during our pilot phase. So making sure we can put these in a break glass in the case of emergency box, rather than on individuals' necks, could be something that we look towards.
I can see there's a huge market there. We read about someone buying something from Pret or something like that, and they go into shock and pass away. And I'm wondering, did you create this with EasyJet in mind? But my more serious question is,
I'm afraid that is time. Sorry, Sheila, but thank you all very much.